a high school patient of mine ask me a question this week, which I thought was very intriguing. He simply posed the question about how does he not have to have surgery at some point? And ultimately where his question was coming from is that he had had a family member who'd had a major surgery, ended up having multiple vertebrae in her neck fused together as a result of having a very bad disc herniation. And ultimately he simply wanted to know how he could prevent that from ever having to happen to him. And that question is really what I feel is at the crux of most of our healthcare problems, is that ultimately we do very, very little when it comes to prevention. But once that problem comes, once that disease comes, then we'll pull out all the stops to try to fix it. And yet many of our problems that we experience, whether it's musculoskeletal pain or skeletal things that we deal with on a day-to-day basis, or whether it's somebody with diabetes or with heart disease or cancer, you name it, most of these things, the problem is that we've not done the right things on the front end, the preventative healthcare, how we refer to that. And so we've done nothing to keep ourselves healthy. And yet, that's going to lead us to getting sick, having some type of problem. And then it's almost too late when we start, okay, how do we fix this? And so that's a really hard part. And so with many people, just like this student asking me, how can he prevent having to have neck surgery someday? What we see when we deal with the spine, it's a matter of, well, we need to keep the spine healthy. So when you turn 30 or you turn 40 years old, you don't start now having major serious neck problems or spinal problems. And so to me, it was like, I wish everybody asked that same question, because my ultimate answer to him was, well, it starts early on. It starts at your age. And so kind of excited, since he's a patient and he's getting good care, we're kind of setting him off on a path that hopefully he'll never have those problems when he gets to that point. And so it's very exciting for me, because that's really the passion that I have. Yes, we want to get people feeling better, but what I really want is to prevent people from ever having to have these problems at some point in their life. And for most time, it's really about starting the kids early on, getting them, making sure their spine is healthy, their body's healthy, nutrition, all the right things. And they're not going to have ear infections all the time. They're not going to be getting sick all the time. They're not going to, be pre-diabetic. They're not going to have a high risk of heart disease or high risk of cancer. And that excites me, because that ultimately is changing a community, changing a generation, and the outcome of their health. And that's significant. When you look at the overall conditions right now in America, we have more obesity, we have more heart disease, more cancer than physically ever in the history of humankind. And yet, when you look at our healthcare system, we spend, I think last numbers I've seen were over $4 trillion a year in healthcare. And so we spend that much money, and yet we look at the outcome and we're sicker than we've ever been. And so that's a problem. And so this is really our heart and what we want to get, really improved.